All right, so Doc, we are back again. So
Sure, welcome.
we'll now move to the
The lab.
laboratory.
Yes,
Okay,
please.
so let's move to the laboratory and then we see what they have. So there's a lab.
Yeah.
All right, so all right, so we are in the lab now. We are in the lab. We are in the lab. We are in the lab.
So
All
we
right,
have
so let's enter. Can we close the door? So sure, sure,
this
sure.
is our lab
Okay, okay.
and our technician,
All right,
Isaac.
beautiful,
So
beautiful.
he'll briefly take you through what we do.
All right, all right. So, Isaac, shall I welcome to the JMall Life?
Oh, thank you.
Beautiful. So, my name is Mr. Hansen. So, what we do inside JMall Life is we rent the shop inside the Junction Mall to people on social media. So, that's why today we're here. We've been doing this a couple of months ago, and today we're here. So, what did you do in your lab?
Okay, normally we run every test over a year. Almost 99% of our tests run it over a year.
Okay,
We have a chemistry analyzer over there,
okay.
having our FBC machine over there, and having our HbA1c machine,
Okay,
and that's our centrifuge.
okay.
So the basic labs, which is the HIV, the blood level, the FBC, the malaria, the typhoid, we do everything over a year, together with the lipid, LFT, which is the liver function test, the cholesterol, we got the BU criteria, the kidney. We do everything over a year.
Oh, wow. Wow, beautiful. So all tests.
All tests we run over a year within the shortest possible time,
Wow.
maximum of 2 days. You get your results.
Do you do HIV testing?
Yes, you do. Get the results the same very day.
Wow, the same very day.
The same very day.
Wow. Wow. So how does that test go about? What do you need for that test?
We just take a blood sample,
Okay.
then we spin it in the centrifuge over there.
Okay.
That's the centrifuge.
Okay.
Then we take the serum, then run the test with it. Then to give us our results, whether you're positive or you're negative, which you can also select known as reactive or non-reactive.
Okay. Okay. So aside that, which other tests do clients come here majorly for?
Okay, no, because of the malaria process, which is very common in Ghana or in Africa, so we normally run the basic ones are the malaria and the FBC and the urinary. But normally to go for the pregnancy test, normally having the 2 times, have the UPT, which is the urine pregnancy test, and the BPT, which is the blood pregnancy test. So when I run those 2 tests over here.
All right. So beautiful, beautiful. So that is what you heard from. Should I call you doctor?
I'm not a doctor.
You are
I'm a lab technician.
a lab technician, but there should be a title for you people.
Medical lab technician,
Okay.
MLS.
MLS. Okay, so MLS here inside the life healthcare. So they deal with all sort of laboratory testing. You can come here anytime. The Junction Mall, as I've been saying always, is located at the Nungwa barrier. Ask anyone, you're going to Nungwa barrier. When you just alight, the Junction Mall is just behind you. Locate them and then come and get yourself tested. So, Doc, we'll be taking a leave of you.
Okay.
What would you tell viewers? What would you tell the general public right now?
I can say that maybe the body is just like a car engine. You can come in for a test. It's better you come in for a test to know whether there's something wrong or there's nothing wrong. It's better you do. It's better you just do. And the tests are very cheap too.
Very, very affordable.
Very affordable. Very affordable.
Nice one. So would you just give us a tidbit of it, like the HIV test? How much does it cost? Because a lot of people are scared.
Okay, yeah, actually, I don't know the test of it. It's on the machine. So you go to the reception, then they'll tell you the price over there. So you can just come in and say maybe say window shopping. You can have the price. Then you know the price.
Yeah, window shopping so far.
Oh, where there? I Ghana.
Hey.
Ghana there, baby, window shopping.
In a hospital, so yeah, window shopping.
People can just have they just come into you like have a pee like of the place and just remember see me test how much is it. Okay, then you just go. Yeah, so you can also come and just check. They're always ready for you.
Beautiful. So as you heard, you can come for your window shopping. Just come and ask of anything, Charlie. Yes, ask them anything, and if they have that solution, they'll give it to you. Thank you so much, Isaac, for that wonderful discussion. All right, so that is the laboratory section of life healthcare. Why do I always want to say health? Yes. So we are still inside. So probably we'll be moving to the dental surgery there. Yes. So um, lab. Doc, I salute you.
I salute you, boss.
JMall life. Me sing. Me ya. To crab a dim. Kakao womb. Diana menye.
Oh, when you come, I'll examine you. After examination, per your presenting complaints, say maybe you can't chew there, or when you're taking out or cold food, you feel more sensitivity. So after that, I'll take an X-ray. Then we'll see the extent of the cavity, and depending, we'll do whether we have to do a simple filling for you, we have to do an advanced form of filling, or we have to take it out. So depending on the X-ray and our clinical findings, we'll see what we do for you.
You made mention of simple filling. You made mention of other fillings. Give us an insight of this both fillings.
Okay, so let's go to this
Beautiful.
this image and let me describe it more for you. So normally when we have a cavity, first it starts with food packing at that side, no form of pain. But when it moves ahead, you still feel some sensitivity when you take hot or cold food. Then it moves here to this side. This is the pop. That's where the blood vessels and the nerves of the tooth is. When it gets there, normally it comes with it disturbs your sleep. You are not able to chew there. So that's when we get to here, we do the advanced filling. But when it gets to here and here, we call it enamel, and the enamel, dentine, and pop. So when it's here, we do a simple filling for you. Here too, we coat. Here is the sensitive part, so we just coat it small and put a simple filling on it. But when it gets here, that's we do the advanced treatment. It's called root canal therapy. And when it's badly broken down, that's when we have to take it out and do a replacement for you. And the replacement, there are types. You have the removable type and the fixed type, depending on the patient preference and the financial constraint too, and the anatomy and when we examine the patient, what the patient the month deserve, that's what we'll do.
All right. So basically that is it. So I guess you've been enlightened about this feeling thing. Yeah. So come whichever thing you'll be examined and then you'll be given that feeling.
Yes, and we also do teeth cleaning, that's cleaning and polishing, and also whitening. And we fix braces too as well. When the teeth is malaligned, we fix braces to arrange very nicely for the patient.
See, obviously, when you want to look at the people who have this yellow teeth, if I'm not shy to say it, most of us celebrities have this yellow teeth, I must say, because they hardly get time to maybe brush and that, because anytime they are on the go. I know a couple of them. Probably I don't want to mention them, but how can you see a teeth which is so severely yellow? How can you polish it to be that whitish?
First of all, let me explain to you. You see, adult teeth are not extremely white, as people think your teeth has to be very white. You understand? You see, these are what I told you, this enamel, dentine, and pulp. They are dentine, which is this side. It's not dense. So it can't reflect over the whiter part. So that's why our baby teeth are very white, as compared to adult teeth. The adult teeth, when it comes to this dentine, it's very, very dense. So it translates the whiter part that side, so making it look like it's a creamish color that way. And we have something we call plaque. Plaque is the yellow thing that we see on our teeth. When it stays there for long without being cleaned, it's tends to crack. It's within the tooth. Some may be on the surface, some will be on the tooth. That's why most of the time we do the bleaching and other form of, because something like a veneer, like you have a table that.
So the teeth, you do bleaching on the teeth.
Yeah, that's tooth whitening. Oh. Another name for it, you call it whitening. Yes.
Bleaching.
It's whitening. Yes. Yes, it's whitening. So that's what we do when most of the stains cannot be removed by the normal cleaning.
All right. So Doc, why is it so essential that we should brush our teeth morning and evening? Why is it so important?
So first of all, when we don't brush our teeth, look at this structure very as I'm using this one. I think let's use the normal anatomy. Okay. Doc, can I get the other one?
And also after that, you just tell us because when I was in tertiary, like I had this guy who was using one brush from level 100 to level 400 and level 300. Yes.
You advising?
Oh no, but like I say, and tough for men say, so why should I change it? Yes, but I had a couple of times that at least 3 months you should change your brush and that.
You have to
Yes.
change. And even some it doesn't have to be 3 months. Normally, when a patient comes in and we do cleaning, we tell the patient to change the toothbrush. Yes, after we clean your teeth nicely, we don't expect you to go and use the old one, but you change it to use the new toothbrush. So as I was saying, we need to clean our teeth to prevent that. Yes, to prevent the plaque in our teeth. When it's not being cleaned, it tends to calculus and damages the gum around the tooth surface. So it's making it redden. Normally, when you brush, you tend to be having blood, bleeding gum from brushing. Yes, and also it weakens the gum around the tooth. In no time, the tooth starts to shake. Yeah, so we have grades of the mobility of the tooth start to just shake, and also mouth odor, as we call it, halitosis, tends to have bad breath. Yes, so we need to try and make.
Beautiful. So Dr. Nikwe has really educated us on how we can prevent this unwanted things on our gums.
Morning, evening, morning, evening, morning, evening. Most people tend to brush in the morning, and even if it is the most important. After you've taken all that you want to take, then you go and sleep with it. It's not.
Dr. Ni, be nyemega mele be chale. I mean, I know from be FTM.
I'm not sure that you got. I'm not sure that.
They should be a talk comic on day. Yeah,
but I get me was sure that lady couldn't work there. Can't you forget? When you name ona she je ka fe na gam ona gba ke mo no ye ni epi ni eye oda fe food residue ona no more asando brush na ji she I feel like na taste lebi e was ni ashada mo ko no de ka chi gba ke ndi ka no na ka no awo
we are putting da sha mo le je ko la ka na ba no ke ni bi a check nda ni aya nda no ke ni bi a check
nda aso was short because as we age too the supporting part of the tooth, it becomes weaker a little bit. So if you don't maintain a very good oral hygiene at the tender age or your middle age, when you get to that age, it will aggravate more. So your teeth will just be like shaking, all of them. We have to take them out and give you replacement, which is not the way. Normally, it's good to keep what is natural than to have the artificial.
Oh, so you have artificial teeth here?
Oh, yes. Oh, yes.
Are they the ones we see in their more like this goldish?
We have the replacement. So when a client comes in, I have a missing tooth. I want to take it out. We'll give the options. After examining you, we'll give you the options. You have one that you can wear and remove, and one that is fixed. The one that you can wear and remove, you have two types. We have the hard one and the soft one. The hard one is the dentures, and the soft one, they are the flexible dentures. You can have like Vapla. So, depending on your money the cost and everything, then we just get to. And the fixed one, we have something called like a bridge. An implant. So you choose the one that's depending, and after examining you, what?
Dr. Nikwe, thank you, but we need to can see a lot of.
Yes. I have a client who will come in soon for replacement. They are bringing the so. If you can linger around, so I'm sure you have a look at it.
Wow.
You have a look at it.
So this for replacement?
Yes, I'm about to replace a patient's teeth.
Okay, so doc will be having a replacement, but okay, so this is a dental chair. Okay. Oh, okay, beautiful. All right, and that one as well. It's also a dental chair.
Yes, so we have two dental chairs.
Okay.
Yeah, we have two dental chairs that we use over here, and we provide all the dental services. So we accept. We accept the insurance cards, the Nationwide, the Acacia, the Premier, the Metropolitan, all of them. So you just walk in, clients you can walk in, and we have it. And then we start work from weekdays. We start from 9 to as long as 7 to 8 p.m. So those workers who don't have time to come in the morning, they can just book appointment in the evening for treatment done. And as much as possible, we need to have our teeth checked every 6 months. Yes, if you don't have pain, every 6 months you need to come for us to check your teeth for you. Yes, recommended. Is that?
Not for me.
Oh, back we go down.
Down.
As do back up, but I don't go check my exam.
So that I will know if my teeth are shaking or something. Yeah. So, Doc, Thank you so much. So this is the dental lab, the dental unit of Life Health Care. Yes, so that's what they do. You've heard Dr. Nikwe spoken a lot. So you should come, change your toothbrush. And I mean, I beg you, that morning, evening brushing, please observe it as the way you're observing all the protocols being laid down to fight the COVID-19. You should observe that. It's for your own good. Don't say you don't do this thing. So you don't eat regularly, so you don't have to brush your teeth. Masa, brush your teeth because the teeth is in your human being. You understand? That's it. So, but I can see some brushes there.
Okay,
Are
so-
there some prescribed brushes for?
Yes, so these are most of the toothbrushes I prescribe for my clients. It's why the Oral-B toothbrush. So the bristles are soft, they're soft to the medium, and I really like it because the bristles are not hard. Most of the clients working, when you ask them what toothbrush, you will tell smokers and even some brands that you don't even know the name. Yes, and the toothpaste that we use has this abrasive material in them. So imagine an abrasive material in the toothpaste, and you are using a very hard toothbrush. You tend to wear off your tooth surfaces, and very soon you start having sensitivity. So most of the clients they'll come in that I'm having sensitivity or have sensitivity tooth. It depends on the mechanism of how they brush their teeth and the toothbrush they use. Yeah, and also if they don't maintain a very good oral hygiene. So that's why. So when you come, you just educate them on it, clean their teeth, and prescribe the toothbrushes for them to use. And I see them regularly on 6 months interval. Unless they have pain, they'll come before. But if not, every 6 months they should come. And we are here on weekends too. Yes, we are here on weekends too. And if at all you don't have time at all, on Sunday you can book for executive consultation on Sundays. We can come and see you as well.
Doc, quick one before I move on with my running mate. Doctor. Yeah. So a couple of times we've seen people with this half tooth, like their teeth are half. Have you observed that?
Are you talking about those who have a fractured tooth? They call it ekbation, or it's falling out the tooth is broken. Yeah. So this time we have various ways of solving the issues. You just come, we examine you. If you need a filling to build the tooth up, or we have to put a crown on it, you don't have a problem. We'll give you the various options, and we choose the best one out of it. Yeah. Crown, there are various types. So depending on the type that we have that can cost as 400, 800, 1,500, 2,000. So we'll give you the options. And depending on financial constraints or even the cost. If some of them, if you don't really have, we see, yes, I'm very soft. I'm very soft. So when you can, I'm very soft. So you can give me a jaw. So I'll deal with you and just give you a nice package.
So you've heard it, Dr. Nikwe, NGO. When you come, we'll just see you through. If you don't have Krana, Charlie, he will see how to mobilize something for you to suit you, for you also to feel comfortable. Thank you so much, Dr. Nikwe. So thank you so much. So, Doc, we are learning a lot.
Sure.
This is not your department, but can you tell us something about this department?
For the dental, it's more on your face. So whatever goes on with your teeth, just know that it's the doorway to the rest of your body. So you should take this seriously, the dental department. And as my colleague said, routine screening is very important. And you start that way, then you identify the problems earlier. You don't wait till you're old, or you don't wait till before you go on a date to go and check your teeth.
Go on a date.
Yeah, we mostly have clients who, before they go and see the lady for the first time, want to make sure that everything is fine.
Me?
When they're going for their wedding or engagement, that's when they come. But they should make cannot be a bit and come in every 6 months.
So after the date, then you'll not come again.
They won't come again. They'll run away. So that's one thing. I don't know, but it seems dental service is more of in Ghana, people of the middle class or the higher class, they tend to come But the lower class, they come when they have maybe have a toothache, yes. But it shouldn't be the case. Yes, they should come and we come here every 6 months.
Sometimes it's the way the health practitioners are preaching it, because they preach it to be more expensive and for the top class people. But in as much as it is for every class, we should have a way we can educate each and every class, so that we should know that it should be an habitual something for everyone. Yeah.
For us like this, every quarter we do screening at the front desk. We do free screening. So when you come, we screen you, we examine your teeth, and we tell you what you're supposed to do, and so then later they will prepare and come. And like I said, I'm very soft, so I will say yes. I will,
You are very soft.
yes. So I'll just say that if it makes your teeth, you have a nice smile. To meet your
It's good to have a nice smell when you go on a date and you go and do hi. All right, so thank you so much, Doc Nico, once again, Charlie. Thank you so much. So we are moving, but we'll come back for that feeling. Yes, we'll come back and observe it. Sure. We'll come back and observe it. Good. All right, so we're moving out. So I guess you've learned a lot, and so we're moving out, and then we see, I guess finally as the end of the wrap, so that we do more, and then so we've learned a lot inside here, and this is still the JMall life. Trust me. So Doc, we've journeyed all through the lab. We've journeyed all through this clinic. I must say, it is amazing. Who can make it to this facility?
Anyone and from any age. You get it? The healthcare spans from birth all the way to the elderly. Yeah. So what we suggest is that no matter the age, you can just come around. Even if you don't even have a health problem, it's better you come and you screen. Some people have some conditions for which they do not know that they have. So they come up with an emergency, then we tell them that, oh, one day your sugar is up, or maybe your blood pressure is high. So at that moment, you come in and ask these questions. Maybe through a simple counseling or simple advice, you get to know these conditions you have. Then I might suggest some labs for you, or I might even send you to see the optician or the dentist. Then from there, we can identify your problems and manage to solve it. The earlier, the better.
Beautiful, doctor. Beautiful, doctor. So that was what doctor said. So, doc, before we take a leave of you, probably your social media handles, if you have, or where we can locate you aside the Junction Mall, other branches you also
Sure.
perform.
Okay, so we have other branches at Achimota Mall. We have at Junction Mall, that's here, Palace Mall, and then Accra Mall too, inside the mall pharmacy. Yeah. And then we work on every day. But we work from Mondays to Saturdays, that's from 10 a.m. to 8 p.m. And then on Sundays from 12 to 6. Yeah.
Beautiful, beautiful. So your contact numbers, where we can locate you, probably. If we want to come, we want to find out things that you do,
Sure.
you can call and
The
get
number.
more location verification.
Okay, so it's a Facebook handle.
Okay.
That's Live Healthcare, Medical and Dental.
Okay.
Then you can check it up to see. Or with a mall pharmacy.
The more pharmacy.
Yeah, when you check that, you're able to access. I was saying, have our contact number on the pages too. So if anything, you can just text us, call us, or even just tweet, whatever it is. Then
All right. Thank you so much, Doc. Doc, your name again?
Okran.
Okran.
Yes.
All right. So Doc Okran took us around department inside the Life Health Care, inside the Junction Mall. They are in the same building with the mall pharmacy. So locate them and then come get yourself checked out. Whatever thing is wrong with you, come here and get yourself diagnosed. Thank you so much. And this has been the JMall Live with me, Mr. Hansen. Thank you so much, Joel, for taking the camera. Thank you so much, Reggie. Thank you so much, everyone. See you.